So we are so excited tonight to have Dr. Jonathan Otten from Northern Lights Medicine. So Dr. Otten is a naturopathic doctor who is passionate about helping individuals with complex illness to recover their health. He specializes in Lyme disease and other tick-borne illness, autism, as well as other neuroimmune-mediated conditions. He also treats a wide variety of gastrointestinal, immunological, endocrinological, and rheumatological conditions. I get points for all of those illogicals that I just said. Dr. Otten will be the first naturopathic doctor in the state of Minnesota to be a fellow of the Medical Academy of Pediatric Special Needs, a forward-thinking group of medical professionals focused on the biomedical treatment of children with autism spectrum disorder and other neurodevelopmental disorders. He began studying autism 16 years ago while a pre-med student at the University of Minnesota, his interest being sparked while caring for a close family member with the condition. Now his 5-year-old son, Xander, is on his own path of recovery from autism. Dr. Otten has an intense interest in helping each child that comes to his office reach his or her full potential. When he is not caring for patients, he loves spending time with his wife and their 3 young children and enjoys cooking, grilling, camping, and riding his fat tire bike on trails throughout Minnesota. So we are so excited to have Dr. Otten here with us tonight. And if you have any questions, if you can leave them till the end, you want to write them down on a piece of paper, and then we'll do all of our questions in chat. If it's something you need something with right in that moment, I'll be keeping an eye on the chat. So take it away, Dr. Otten.
Thank you, Dorian, and thank you, Anne and the Minnesota Lyme Association for inviting me tonight. I was very much looking forward to presenting this topic. It's something that's very near and dear to my heart and something I find very exciting and is helping a lot of our patients. And so I want to share that with you tonight. So we're going to talk about some advances in Lyme diagnostics. It's not exactly a new topic, but I find when I'm visiting with patients and people, it's a kind of testing that many people are not very familiar with. And we're also going to talk about how we can use this testing to guide really good treatment plans and help to facilitate full recovery from Lyme and tick-borne illness, or as much recovery as we can possibly achieve. Disclosure, I have no financial affiliation with the laboratory testing we will be discussing today. And a special acknowledgement to Dr. Karsten Nicholas in Europe. A couple of years ago, I spent some time with him in Germany. He's a very kind medical doctor, one of the top tick-borne experts in Europe. And he has taken time to share with me what he's learned in his 40 years of treating tick-borne disease. So thank you to Dr. Karsten. So our learning objectives tonight is to understand the unique nature of T-cell provocation testing. That's the kind of testing we're going to be talking about. It's also called an ELISpot. And we're specifically talking tonight about this testing through InfectoLab Americas, which is a local lab here. We're very fortunate right here in Oakdale, Minnesota. So clinics in the Twin Cities, we get processing the same day, which is just fantastic for the sensitivity of this test. And then we're going to look at several case studies of patients in my clinic who this testing has very much helped guide the course of treatment. And we're going to discuss various therapeutic options that we can consider in these cases. So just a quick history of ELISpot testing. It was first developed in the 1980s, and actually it has its origins in transplant medicine. So they could use this kind of test to basically assess the risk of rejection of an organ or the risk that the organ would be impaired post-transplantation. So it eventually made its way into the realm of tick-borne disease, infectious disease. Now, I don't want to get all geeky on us tonight, but I want to briefly cover the immune system. We've got our innate immune system where we get a rapid response to an infection. And then we've got our adaptive immune response. And most of our testing for tick-borne disease is utilizing this adaptive immune response for our tests. So most people are familiar with this left side, the humoral or antibody-mediated immune response. And that's what people are familiar with when you talk about gaining antibodies to an infection or getting a vaccination and acquiring antibody immunity. This is this side, and this is only one part of the adaptive immune response. We have a whole other side called cell-mediated immunity, and this is basically carried out by T cells. And the testing we're talking about tonight is using this right side immune response. So how do we get infected? You know, we've got to get an infection through the skin, it's got to breach those barriers, those first line of defense. So let's just pretend this image here, these purple is Borrelia, Lyme, and antigen presenting cells pick up the antigens, and they then migrate into lymph nodes and they present those to naive T cells. And then the environment, the situation determines what kind of T cell production we get. We've got effector T cells that are really present during active infection, cranking out interferon gamma. We've got central memory T cells, and they produce what's called interleukin-2. And this is oversimplified, but it basically, this is how this test works. So this is an image just to illustrate that this testing during an acute infection or a reactivation of infection, I'm pointing here to this top image, we are going to see more of an interferon gamma response. And then as we clear the infection, we'll see interferon gamma levels drop, but we'll see interleukin-2 come up. And eventually, if the infection's cleared, both will go negative. Many chronic Lyme patients, before I advance the slide, are somewhere in this lower level image where there's the infection is somewhat controlled, but there's still evidence of persistence of active infection. And this is a slide I included of how the lab does it, but we're not going to go into details in that tonight. But I included this slide for anyone who'd like to read it. Read it in the future, that is. I realize I advanced that. So the key benefits of this testing is that we get a rapid, what I call on the ground picture of the state of the infection by measuring the presence of active fighting antigen specific T cells. So these are T cells that are focused on that particular pathogen, whether we're talking about Lyme or one of the tick-borne co-infections like Bartonella or Babesia. One benefit of this is many of our chronically ill folks, who have been infected for a very long time, say in my practice, sometimes people have been sick for 20 years, 30 years before they ever got help from someone with expertise in tick-borne disease. They have to expect them to have any kind of an antibody signature or a positive Western blot or anything at that point is really unlikely. And part of that's because of immune evasion that happens with Borrelia, and also immunosuppression. And so we may not see any humoral or antibody response. And in my clinical experience, we often in those cases, we can pick up on a T cell response. And then finally, the ELISpot testing can help us understand really if our treatment plan is working at all. We often judge that based on the patient's clinical response or symptoms, but it's also helpful to have objective data that we are actually clearing the infection, and it can help us decide when we can relax from therapy. So let's look at a few cases. And I picked some ones that are very typical and kind of present a classic response of what we would expect. So this is a 57-year-old gentleman who came to our office in October of last year. And he's an outdoors guy, spends a lot of time outdoors. He lives in the Twin Cities, but he enjoys time at his cabin in Wisconsin. And in 2017, he developed a erythema migrans, or EM rash, also called the bullseye rash. And it became 6 to 8 inches in diameter. He sought the care of his primary care doc, who thankfully put him on 2 weeks of antibiotics after seeing that rash. The rash resolved, which it, as many of you know, the rash will resolve whether or not the infection is treated. And so the standard Lyme antibody testing done at the time of the rash was negative. Now, most of our audience tonight knows that an EM rash is pathognomonic for Lyme disease. It means there is Lyme disease. You do not need any testing to verify that an expanding bullseye rash is equivalent to having an infection with Borrelia. So did 2 weeks of antibiotics prescribed by the primary care doctor cut it for him? Unfortunately, it didn't appear to. So while he was healthy at the time of the bite and didn't have any real issues at the time of the bite other than the rash, over the next few years, he developed stabbing pains in his arms, a lot of forgetfulness, short-term memory issues, joint pains in his hips, hands, fingers, shoulders, feet, tinnitus or ringing in the ears, but he suspects this precedes the tick bite and was due to a lot of rock concerts and motorcycles. So, and also a little bit of mild disequilibrium, balance issues. Does this sound familiar to anyone tonight? So we run additional initial laboratory work in our clinic. Normal CBC, complete blood count, looking for any, scary infection, anything wrong with his liver, kidneys, everything looks normal, except for he does have some low vitamin D, which is really important for a proper immune function. And then we run T cell testing through InfectoLab, and we note that he has, and I checked him for the big common tick-borne infections in Minnesota, Wisconsin, and some of the common ones globally, actually, which is Borrelia, Burgdorferi, Lyme, Bartonella, and Babesia. And he is showing an interferon gamma active infection response to all 3 of those pathogens. And it's important that we know that all 3 of those pathogens are there because they require different approaches. So in November, a couple weeks after we first saw him, he's right away started on herbal antimicrobials and herbal detoxification support. I also load him up with vitamins, minerals, fatty acids. We have him on probiotics to support healthy gut ecology while we are using antimicrobials. We try to correct his marginal vitamin D status with some oral vitamin D. And then finally, he started on a triple regimen of antibiotics, choosing initially azithromycin, rifampin, and minocycline. And so this herbal regimen he is on, as well as the antibiotics, we have very good coverage for Babesia with the herbal, and more focused on Bartonella and Lyme with the antibiotic regimen. At the 2-month follow-up visit in early January, he first says, I'm 100% better. Well, I don't quite buy that, because that's too soon to be completely better. On more careful questioning, he says, well, no, my chronic pain is so significantly reduced that I'd be happy to live the rest of my days in this state, and his cognitive function is back to normal. So do we retest at this point? For cost reasons, we decide, no, let's treat a little bit longer. So we continue another 2 months with treatment, and we do decrease the number of days of herbal treatment to save him some dollars, because he's feeling pretty good. We're going to see if we can take a slightly more conservative approach. So 2 months later, so now 4 months into the plan, it's time to repeat testing. The repeat test shows that the interferon gamma response is falling. So going from a 13.5 to a 5 for the first Borrelia marker, for the second Borrelia 9 to 6. And Bartonella has gone negative atypically quickly, actually. And Babesia is trending toward resolution at the 4-month mark of therapy. So what have we learned? Bartonella's resolved. Lyme is trending well in the right direction, though there's some ways to go. And Babesia appears to be resolving. There's still an interleukin-2 signature, but no interferon gamma. So how is this intel helpful? Well, in this particular case, this would be a gentleman who would be happy to stop therapy based on how he's feeling. But with that data, we know that Lyme, Borrelia, is persisting, and so is Babesia is likely persisting. Bartonella is, for all intents and purposes, controlled at this time, at least according to the lab. So we decide to modify his antibiotic regimen at this time. And that brings us up to the current day with this gentleman. Here's a second case. This is a 34-year-old male, a young gentleman. He presents also in October of last year, and his main symptoms are burning, aching pain in his hands. Started the year prior. His doctors thought maybe it was some carpal tunnel, and he started wearing a brace, which seemed to help, but then it went from his left hand to his right hand. He was getting knee pain, at times so severe that he was really had trouble walking. And it was first in the right knee and then moved to the left knee. And he would wear braces, which seemed to help him. He would have intermittent elbow pain. He would have this aching pain right above his belly button. That was kind of odd. And he says, I feel fatigued behind my eyes. And I put a quote, he says, I feel wobbly and stiff like an old man. And the month prior, before coming to our clinic, he said he could barely walk at times, and found that to be really embarrassing, because there was no ostensible reason that he should have any issues with joint pain and so forth from standard lab workup. So our initial lab workup in our clinic, he had never been tested with the standard testing for Lyme. So I ran traditional serologies and a Western blot through a standard lab, not IGeneX or anything, and it was all negative. I checked his gut barrier function to see if he had intestinal permeability and if that was really what was driving the inflammation and his joint pains. And then we ran tick-borne ELISpots for Lyme and Bartonella. And you may ask, well, why didn't you check Babesia? That's common. He really was lacking the clinical picture of Babesia. His symptoms were really more just pain, joint pain. So Bartonella and Borrelia Lyme are much more consistent with his picture. And here we see active Lyme, active Bartonella. Patient, we give him all the options, and he's really not sure whether he wants antibiotics for good reason. We know that they disrupt the gut ecology, the microbiome, and he's wondering if we could strictly use a natural approach. So we start him on herbal therapy a couple weeks after we first met him in November. At our two-month follow-up, he reports that in the first couple of weeks of treatment, he had significant reduction in joint pain. And that's when he actually made the decision not to consider adding antibiotics, because he had such a good response to herbal therapy. The pain behind his eyes has improved. We used some high quality turmeric type nutraceutical for when he would have flares in pain. And we added some additional collagen support and some 5-HTP to help with his sleep. And we decide that we're going to recheck Lyme testing in 4 months. So this is his March report, his 4-month report. And here I put it up side by side so we can again see the interferon gamma for Borrelia B31 antigen mix has gone from 16.5 to 3. The Borrelia burgdorferi OSP interferon gamma 4.5 to 2, which is technically borderline or negative, well, borderline. And we are seeing his interleukin 2, the memory cell response, come up. And Bartonella has come down from a 9.5 prior to treatment to a 2. So it appears the protocol, even though we're using strictly herbal nutraceutical therapy, he is responding very well. And that actually, I followed up with this gentleman this week, and he says he feels back to normal, and but based on this testing, that there is still persistence of Lyme. We are going to continue herbal therapy for the next 4 months and then reassess. One final case. This is a delightful, high energetic 62-year-old female. She's actually appears to be very healthy in a lot of respects, and she remains very active with work and so forth. But she's got some nagging symptoms that have never really been figured out. And she tells me she has a history of Lyme disease that she contracted while visiting the beautiful North Shore, camping on the North Shore in 2006. And her Lyme was not diagnosed with labs. It was electrodermal testing through some other practitioner who treated her with 18 months of some sort of herbal therapy. And I don't know the details of that. But she had not had traditional type lab workups for Lyme disease. And by the time, so when she presented to our clinic, it's now 13 years after she likely was infected. And her main symptoms are night sweats every night of the week, almost every night. And these night sweats, she's 62, she's postmenopausal. She thought maybe were hormonal, but they never responded to hormone replacement therapy when she had been on HRT in the past. She had air hunger, which is like shortness of breath or the sensation that you can't quite get a full breath. And she had brain fog, though she was still able to work. She had brain fog and short-term memory issues. And then she had this annoying lower leg pain that was really curtailing her physical activity. She would otherwise be very active, cycling and so forth. So right away, the first thing I think of, and maybe everyone can think of, if they can think of a tick-borne pathogen that really screams out here, she's got classic presentation of babesiosis, the parasitic infection these ticks transmit that causes night sweats and air hunger and cognitive disturbances. But she likely also has some other infections besides babesia. And that turns out to be the case. She's got all three. So we start her on herbal therapy within weeks. And we also start her on atovaquone and azithromycin for babesiosis. Atovaquone is a wonderful antiparasitic medication. Azithromycin is a very common antibiotic, of course. And the combination can be quite effective for babesia. So at 1 month follow-up, she tells me she's got a decrease in leg and feet pain. Her night sweats are slightly less intense, but they're still every night. Her shortness of breath, air hunger has improved slightly, and she's more fatigued and a little constipated, but still having BMs most days of the week. So we decide to continue the treatment for babesiosis, and we add in a spore-based probiotic to her regimen. And 1 month is really early to expect major changes, but sometimes with babesia, we see major changes in weeks. By the 2 month follow-up, she's got a 60% improvement, subjective improvement in her shortness of breath, 80% resolution in leg pain, and she still is fatigued, but she's got a lot of situational stress due to a family issue, and she's got an associated lack of sleep secondary to the stress. So we continue antibiotics for a 3rd month, and then we do a follow-up test. And she is showing clear improvements for Lyme, Bartonella, and babesia. Let's see if I have a comparison slide. No, don't. But basically, it's all trending toward resolution compared to the first test. And part of this is, I'm not sure if you can see the bottom of the slide, but she has pretty good immune function. Her CD57 count and so forth looks really good. So at this point, we decide, since of the 3 infections, Lyme is the most persisting. We decide, we have a conversation, and she has been reading about Disulfiram. I won't go into detail tonight with Disulfiram. I know Dr. Karen Verkota gave a very wonderful, comprehensive discussion to this group on Disulfiram last year. But just briefly, for those who don't know, Disulfiram is a novel antimicrobial agent for persistence of Borrelia. In standard use in medicine, it's used for alcoholism. And following a Stanford paper about 4 or 5 years ago, and then the work of Dr. Kenneth Liegner, this drug got a lot of attention in the Lyme community. And when I talked to colleagues locally and around the world, seen very exciting response to Disulfiram. So she goes on Disulfiram for 4 months. When she got to higher dosing of Disulfiram, a lot of her symptoms came back with a vengeance. And dosing was adjusted, and she, by June of 2020, after stopping the Disulfiram, she reports complete resolution of leg pain, night sweats, air hunger. Basically, she's happy. She says, let's, I think I'm cured. So we retest. And the test is consistent with her clinical presentation, what she's reporting. We only see the traces response of possibly Borrelia infection, but it's just very, very trace. But Bartonella and Babesia are now completely negative. And I'm entitled One Cute Kid Picture. These are my three little ones, Theodora, Xander, and Harrison. And I put this in there as a reminder that, you know, it's April. We're now in peak tick-borne illness season here in Minnesota. And we have to protect ourselves, and we've got to protect our children. And preventing Lyme disease is difficult, but not nearly as difficult as trying to treat Lyme disease and get ahead of these infections once they've been smoldering for years or decades or months for that matter. And so we take a lot of steps to try to prevent tick-borne illness in our family. Some of my favorite suggestions, of course, and you guys are very familiar with this, so I won't belabor it, but we've got to do careful tick checks when we're outdoors in Lyme endemic regions. We've got to wash our clothing promptly when we're coming in from wooded areas, so those ticks die in the dryer. Use permethrin products. It's cheap, it's safe when used appropriately. Put that on your hiking shoes, your pants, and that can dramatically reduce the risk of tick bites. You know, this is what the military treats the army fatigues with and so forth. It's really important to do these things to really reduce our risk. We're not going to eliminate our risk, but we can reduce it. And then consider consulting with a physician regarding antibiotic prophylaxis if you do have a black-legged tick bite, because sometimes just prompt prophylaxis is going to prevent all of the sequelae that these infections can cause down the road. So I just want to have that public service announcement that there are things we can do to really reduce our risk. I have a heavily wooded area near my home that I love to hike, but I will not step foot in that particular wooded region during the summer months. I'll hike when it's -10 out there, and I haven't run into a tick yet. But again, permethrin can dramatically reduce risk when you are hiking in those lovely wooded areas. And we shouldn't let the fear of ticks and tick-borne disease stop us from enjoying this gorgeous state that we live in. And we should all be out enjoying that. Thank you very much. And I want to open this up for questions and comments.
Thank you so much, Dr. Otten. So in your chat, folks, if you want to have any questions, if you can just type those into chat, that would be great. And we'll get those out to Dr. Otten. How much does the ELISpot test cost?
So if you're just checking Borrelia Lyme, it's around $300 through Infectolab. I didn't go into, there's other laboratories around the country, around the world that do ELISpot testing. Infectolab is very cost competitive with those, but I feel like it's superior in its quality because of the interferon gamma IL-2 that they include in their ELISpot. And the fact that they're local, we can get the best sensitivity because it's being processed immediately. So $300 basically for a Lyme ELISpot. The panels that do multiple infections, and they've got more than just the Borrelia Bartonella, Babesia, they've got Ehrlichia and mycoplasmas, and so it depends on the extent of the test, but most of the panels are south of $1,000.
Super. Any other questions here? They're quiet tonight. That means you did a good job. They weren't confused.
I appreciate everyone coming when there's such nice balmy weather out there.
Just checking with somebody here. Oh, what evidence do you have that negative InfectoLab ELISpot predicts no persister organisms?
Yeah, thank you, Dr. Vergoto. There is not evidence that a negative, that's a very good point, that a negative test rules out persistence of the infection. And I did not make that clear. So I don't take a negative test to mean we are completely out of the woods, so to speak. But I have found clinically, and it's also been the experience of Dr. Nicholas, that when that testing goes negative, the infection is, for all intents and purposes, very well controlled. Now, and so I'll counsel a patient that if 2 years from now symptoms start creeping back in, well, then we need to reassess, because those infections could indeed be back. And usually when we see reemergence, at least in my practice, it's usually some confluence of factors, usually stress. So someone will have a death of a loved one, a divorce, maybe poor nutrition for a few months, not sleeping, and all of a sudden, boom, their symptom complex is back, and you do the testing and there's evidence that it's clearly active. And then, of course, you need to consider retreating.
Another question here. What are some of the antimicrobial herbs that you use, and for which bacteria?
So I use dozens and dozens of herbal treatments. I use one that we get out of Germany, Austria, called the Lyme Plus regimen. I use Byron White's herbs. I use Buhner type protocols. I'll use just weird naturopathic combinations that are tolerated well. I'll use things like Artemisia and Cryptolepis, and so all kinds of options. I really like Byron White. He's an interesting herbalist out of Northern California, and I use a lot of his herbal formulas in our practice. Basically, I use whatever I find to work in an individual, and sometimes it's frankly trial and error.
Going back to a prior question, have you retested off treatment to see if ELISpot remains negative?
Absolutely. So, and this comes down to be a cost factor for patients. Is basically if they can afford to do testing even when they're feeling healthy and back to normal, it's never a bad idea, say 6 months after cessation of treatment, to reassess and see that things stay quiet.
I tested positive for Lyme disease in July 2020. I was put on doxycycline twice a day for 30 days. I have not had any follow-up, and I realized I am still having symptoms of Lyme disease. Should I seek follow-up treatment with my regular doctor or a specialist?
I recommend that anyone with symptoms of persistence of tick-borne disease seek out a specialist. and because generally in primary care, the only thing that is done is a short course of a single antibiotic, and that's not going to be successful if there is persistence of these organisms.
Are you taking new patients, and what's the best way to schedule an appointment?
We are accepting patients. Sometimes there's a little bit of a wait to be seen in our clinic, but thankfully I've got a colleague, Mary Clark, who's very helpful in us keeping up. And so the best way is to call our office or visit our website. Our website is northernlightsmedicine.com. And you can see our phone number and everything is on there. And we are not to be confused with Northern Lights Pediatric or Northern Lights Plumbing or any other Northern Lights, just northernlightsmedicine.com.
Well, you're kind of working on our plumbing, sort of. Does insurance cover any of the cost of the ELISpot test?
No. So, and this is another thing I didn't include in this discussion. So of course, the standard of care, or rather how the CDC tracks Lyme, as we all know, is using the standard Lyme antibody titer and Western blot that misses, depending on who you ask, which experts in the world you ask, it may be missing 50% or more. But unfortunately, the ELISpot testing is not yet covered by insurance. I'm hopeful, it's a different situation in Europe, in Germany, but I'm hopeful in the coming years that there will be insurance coverage for this test that I just find to be fantastic.
Can patients order ELISpot tests on themselves? Is it just a finger prick drop of blood that is needed?
No, it's a couple tubes of blood, and they can, at least not through InfectoLab, they cannot order it on themselves. I'm not aware if there's any other laboratories in the country that will give lab results to a patient ordering it on themselves. I don't know that. But InfectoLab requires a healthcare professional to order it and interpret it.
One more here. I'm a current patient of Dr. Otten and have been for a little bit. I highly suggest him. As for my question, will I be on treatment for years to control it, or can I get to a spot where treatment isn't needed?
Yeah, that's a great question. My goal is to get all of our patients to a place where they do not need, other than basic good immune support, nutritional, that the basic determinants of health, the basic foundations of health are maintained to try to keep infections at bay. That's my goal for every patient, is to get them to that place. Unfortunately, there is a subset of patients I find that need ongoing treatment, sometimes for years. I mean, for that matter, some people have been on herbal therapy for decades to control their symptoms. In those cases, though, I'm always looking for what in the world else is going on that's causing the immune system to not be able to recover. And that you start to go down some serious rabbit holes. But one common finding in my practice is some of the patients who have chronic relapsing Lyme disease, they have other things that have nothing to do with Lyme directly, such as they've been exposed to mold, and they've accumulated a bunch of mycotoxins that are extraordinarily immunosuppressive, and they can't, until you can clear those mycotoxins out of them, they can never fully recover. So it's always a good idea, if someone is just treading water, for their functional medicine provider or whoever's guiding therapy to do some real investigation and make sure you're not missing something that can be reversed. Because Lyme disease, tick-borne disease, doesn't exist in isolation. Many people who have chronic relapsing Lyme, they've got you know, abnormal gut barrier function, abnormal blood-brain barrier function, and their symptoms are coming from those things. And if those are never addressed, they are going to continue to be symptomatic.
Perfect. So I'm gonna pivot a little bit here. We have a mutual friend of ours is on here tonight, Dr. Otten. Lisa Nigerian is on. So I was wondering if it's okay with you if we just have her on for a second to talk about the Twin Cities Lyme Foundation, which I know is an important part of your life too.
Absolutely, that would be great.
So Lisa, if you want to put your camera on and join us, and if you want to introduce her, Jonathan, that's great.
Okay. Wonderful. Lisa Nigerian is, well, first of all, she's just an incredible human being with a very, very big heart. And I met her, I don't remember how many years ago now, probably 7 years ago. And she has developed a foundation, and I'll let her talk about that. But she's, I can say she's changed hundreds and hundreds and hundreds of lives that I've got to be a part of. And that is just extremely exciting. And so her foundation has got a lot of people on the road toward getting properly diagnosed and on the road to recovery. So,
Lisa, are you there?
I'm here. Can you hear me and see
Oh,
me?
there she is.
Sorry, I'm not super great about this Zoom. It's really good, Dorian. Oh my goodness. So thank you for having me. Thank you for the introduction, Jonathan. You're sweet to say all that stuff. So hello, everyone, everybody that's out there. I am Lisa Nigerian. I am the executive director of Twin Cities Lyme Foundation. And I went undiagnosed for 16 years with Lyme disease, and I have a couple co-infections in the mold, and everything that Jonathan was just talking about, I think you were describing me, right? As a result, I was finally diagnosed in 2015. And as a result of finally being properly diagnosed, I decided to start a foundation, Twin Cities Lyme Foundation. And our mission is to get people properly diagnosed, because Lyme disease is such a convoluted disease. It's very difficult to detect. So I liken it to a pregnant woman having a baby. She would never have a dentist deliver her baby. The same thing with Lyme disease. If you suspect that you might have Lyme disease, you need to get yourself to a Lyme literate practitioner like Jonathan, Dr. Otten, to properly diagnose you and treat you the right way. I would say he can figure out anything. He is equally an incredible human being with a big heart. So it's beneficial for you to get to him. But we as a foundation utilize his expertise to properly diagnose the people that we try to help. So we grant a big chunk of money to Northern Lights Medicine so that we can get people properly diagnosed. So if you need to reach out or have people that that suspect they have Lyme disease and cannot afford to get properly diagnosed, because it can be very expensive. We do not treat, but we do help diagnose. So you can go to our website at twincitieslyme.org and you fill out an assessment, and we go through your assessment, accept you, you pay a small nominal fee as a donation, and then we send you over to Dr. Otten's office. So that's number one. Again, it's twincitieslyme.org. And then secondly, we have a gala each year to help fund the people that need help. And that gala is coming up in May, Lyme Awareness Month, May 21st, and it's virtual. And you can, we're on social media, so Facebook, Instagram, and Twitter. You can just look up Twin Cities Lyme and find us on most of those places. But we will be advertising through our website as well. And we will post a link so that on the night of the gala, which is a free gala, you can just click on the link and join our gala. It's about an hour long. May 21st, it starts at 7 o'clock. And we have a live auction, and we have Jonathan Kane this year, who is the keyboardist for Journey and a good friend of myself and my husband. And he has graciously offered to perform 3 different times on our gala. He's going to do a Journey medley of a lot of Journey songs. And then he's also a Christian singer and has a song that is very relatable to people who are sick with Lyme disease. And then he also is responsible for writing Don't Stop Believing. And he's going to do an unplugged version of that at the end of our gala and tell the story behind it. So along with his entertainment and live auction, a couple of other things, it's going to be hopefully a fun night. We'd love to have you join. So you have to keep checking twincitieslyme.org, go to the events page, and that's where you find the link. So that's it. Thanks for having me, Dorian. Thanks for.
Thank you so much, Lisa. I am hoping that we'll hear you sing your Lyme song too. So
Actually, I'm probably
not gala.
I'm not going to sing that, but that will be in the beginning of the show. So what she's referring to
Super.
is another friend of ours sang a song that I helped him co-write about Lyme disease, and it's not sad. It's actually pretty fun and kind of a upbeat song. So that will be in the beginning of the show. Yeah.
Yay. Awesome. Well, thank you so much for being here, Lisa. And thank you to you and Pete for all you're doing with Twin Cities Lyme Foundation. I know that this has been able to help a lot of people get the testing that they need. So bravo to you guys. You're fantastic. Just fantastic. So thank you. I'm going to flip back to Jonathan now, because we did have one more question on here about the, is the ELISpot test showing levels of current bacteria or past bacteria exposure? How does it differentiate?
Yeah, so it's actually, so it's not a direct test. We don't really have those for Lyme disease, like a culture. Where we can actually grow out the Lyme. We did have a commercially available Lyme culture for a number of years, but that lab went out of business. So all of our testing is based on the immune response. So I just want to make that differentiate, that no test absolutely shows whether there is current bacteria but the T cell test, I can say this, that interferon gamma response, we only should see during active infection. When the infection has resolved within weeks, that infection, that test should go negative. Now, one of the things I learned from my mentor, Dr. Karsten Nicholas, is that it's always a good idea to consider treating, even if it's simply just herbal therapy or whatever you're choosing, to treat a couple of months after the test has gone negative before considering stopping therapy. So I think that answers the question as far as it absolutely can show whether there's a current infection or not.
Awesome. Does anybody else have any other questions for Dr. Otten for tonight? The chat is still open. If anybody has anything. I'm gonna give them just a few minutes, a few seconds here to finish any typing. But Dr. Otten, thank you so much for being here. This was so interesting and fascinating. And, you know, it's, you know, knowledge is power. So, you know, the more information everybody has, the more, you know, hopefully the more they can find the answers that they need. So we really appreciate all that you're doing for our Lyme community and for being here tonight. And just to reiterate for those who weren't on it maybe at the very beginning of the call, we will have a support meeting next week. For MLA, you can find that information on our website under events or on our Facebook page. Also then next month we have Dr. Linda Williams who will be talking about neuropsychiatric symptoms of Lyme disease. She's a psychiatrist out of Seattle. And then in June, Stephanie Belseth will be talking about PANS and the adult onset AANS. So we've got some other great people coming up. So we hope that you will join us. As always, if you need any help, there is a support information on our website also if you just need to talk with somebody. So we're here to help. So I thank you so much, everybody, and I hope everybody has a great week, and by the end of the week we'll see a little sunshine. So thanks, everybody.
Thanks, Dorian.
You're welcome. Thank you.
Thank you, everyone.
Recording here.